As you know, there is a group of physicians in Massachusetts who do not think that ground EMS should be administering pre-hospital blood products. I did a whole podcast where I ripped apart this analysis that was so bad, so feeble, and so fraught with a poor study design. It had crappy numbers. I would offer that the publication of their article was these guys, Michael Dukakis, in the tank moment. And I'm not the only one who thinks this. A letter to the editor has just been published hot off the press in academic emergency medicine. Some big names that you probably recognized said pretty much the same thing, that the analysis was flawed, wasn't generalizable to EMS as a whole. And they mentioned that there certainly are other studies out there that show a clear benefit to pre-hospital blood. Now, these authors are professionals. They were way more politically correct than me, but that's okay. And their letter to the editor was spot on. Nevertheless, the message was the same. So the authors of the original study, Schoenfeld et al., wrote a response letter back and said that there is a paucity of evidence to support pre-hospital blood, which, going along the same lines as their study, wasn't accurate. Their meta-analysis just chose to filter out anything that wasn't a randomized control trial. Remember, they even wrote that they may have left out high quality data by excluding other types of studies. They also admitted that their sample numbers were too low to allow for further analysis, and their own statistical bias tests, one of them passed, the other, it didn't necessarily set the world on fire. They then went on to say that pre-hospital blood needs to be studied more, blah, blah, blah. They mentioned that current studies are being conducted that will hopefully shed more light on whether pre-hospital blood is good for the pre-hospital hemorrhagic shock patient. Duh. I mean, do these people require data to tell them that ice cream tastes good and is enjoyable? And also, you got to read their response letter, because in a total example of old thinking, they bring up that with pre-hospital blood comes a real risk of alloimmunization, which I'm not saying isn't a factor to think about, but that may cause harm to a potential future, maybe going to happen someday fetus. Yes, let's let the young female bleed to death, because that life-saving blood may cause an RH reaction that will affect a future pregnancy. Now, call me simple-minded, but if you let that young female bleed to death, there isn't going to be a future pregnancy. By the way, they could treat for that and make the pregnancy totally viable. Anyway, check out the letter to the editor. I loved it. And stay tuned. You might just hear from a couple of these authors very soon.